every joint in the body can become arthritic. Arthritis is a process where the joint starts to get stiff, starts to become inflamed and painful, and can cause difficulty just walking, squatting down, bending the joint, turning, twisting the joint. Arthritis in the foot and ankle is just as common as any other joint in the body. We take 1 million steps a year, and every one of those steps can be painful. And so as time goes on, if that becomes more and more painful, we have to determine if there is arthritis, where is it coming from? There's 27 joints in the foot and ankle, and any one of those joints can become arthritic. And so as the arthritis progresses, the joint space becomes smaller and smaller. The body forms bone spurs to make the joint stiffer, and then it becomes swollen, painful, and inflamed. We can try bracing for various parts of the foot and ankle. We can try arch supports if the arthritis is in the arch of the foot. When we get back to the ankle, that's a much more challenging problem. Ankle arthritis is not as common as arthritis in the knee and the hip, but it can be just as debilitating. And so when we see these patients, they come in, they have a very swollen, painful ankle, they have difficulty going up and down stairs, they have difficulty just walking even on flat surfaces, but uneven surfaces can be really difficult. And so in those patients, when we first see them, we might try a simple brace around the ankle. We might have them try a little bit of physical therapy. Sometimes we'll do 1 or 2 cortisone injections into the joint to try to get it better. But once they've failed conservative care, then we can offer them surgery. For many, many years, there were 2 options. The first option 30 years ago was to fuse the joint, was to basically eliminate the ankle joint so that this tibia bone and the talus bone were fused at 90 degrees. The ankle would not move, but it did take their pain away. The problem with an ankle fusion was that it would create stress to other parts of the body. And so if the ankle doesn't move, their knee, their hip, their back would take more stress and potentially become painful and arthritic in those joints. And so over the last 30 years, the technology has gotten to the point where we're almost as good as knee replacement. We can do ankle replacement. When we talk about replacing a joint, that joint needs to be recreated. Hips are very easy because they're a ball and socket. And so a ball and socket has lots of room to move. Patients with hip arthritis do really, really well, fairly quickly and predictably, and the hip can last upwards of 30 years. Knee replacements is more of a hinge, and that can last upwards of 20, sometimes 25 years. Ankle replacements are trickier. The surfaces are different. We don't just have a hinge, but we also have another joint on the outside and a joint on the inside. And so with these 3 surfaces, it makes it more and more challenging. Fortunately, the design of ankle replacement has gotten better over the last 15 years or so. So we're at a point now where the replacement can last much, much longer than it did 30 years ago. And so now, if we go in and we replace the ankle joint, we can give patients significant improvement in their pain, their function, their ability to walk distances, providing them with a quality of life. Now, the ankle replacement doesn't last as long as the hip or the knee, and so we try to have patients wait as long as possible. But if they can't wait, we can do the replacement with the understanding that it may need to be revised. It may need to be redone about 15 years later. So it's not quite as long-standing as hips and knees, but the success and the pain relief can be equally good.